Essential tremors and Parkinson's disease affects millions of Americans, oftentimes with debilitating symptoms. Joining us now to discuss an exciting new treatment is Dr. Jan Hachmann with the Orlando Health Neuroscience Institute. Welcome, thanks for being here.
Thank you so much for having me.
Okay, so Parkinson's disease and essential tremors are two different things, but they are both disorders of the nervous system. Can you explain what the difference is?
So they're both what we call movement disorders. So they're neurological conditions that affect how the body it initiates and processes movement. Essential tremor is a oftentimes inherited conditions and a complex pathway. It often affects people during performing actions. So we call that a postural or kinetic tremor. On the flip side, we have Parkinson's disease, which is a neurodegenerative condition that affects a certain neurotransmitter system involving dopamine that causes widespread dysfunction in a number of motor pathways, where we have surgical treatments for both of those options available. And a newer treatment option is focused ultrasound that we have available to treat tremor, either for essential tremor or for a tremor-dominant Parkinson's disease.
And you are getting pretty incredible results. Explain how it works.
It is a wonderful technique, and how it works is it's done in an MRI scanner under MRI monitoring without needing any anesthesia. Then we use a helmet-type device that has ultrasound beams, ultrasound waves, focused on one specific spot in the brain that we can steer and target. And with that, we create heat to create a very small little lesion in a very specific spot of the brain called the thalamus to disrupt the abnormal circuit that causes tremor. The effect is instantaneous. We see it right there on the table. We check periodically throughout until we're happy with what we're getting. Then the procedure is done. The patient gets to get up off the MRI table and gets to go home that same day.
One of the positive things, though, is that you are seeing this is a long-term effect that the procedure has.
Yeah, the effect is durable. We now have long-term data from the approval study out to many years out that has shown that the effect of the tremor relief does last, which is, of course, a huge priority. You know, we want to give a treatment that has a lasting effect on people's quality of life.
How does that make you feel, knowing that you have completely changed someone's life?
It's hard to even put into words, but it's a heartwarming experience, and part of it is, it takes such a big team to make this happen and to get them through the journey, and like seeing that final effect that when the hand just stops shaking, everybody's very happy.
Okay, well, thank you so much, Dr. Hachmann. This is fascinating and exciting for so many people that struggle with these issues. If you'd like more information, you can visit orlandohealth.com/neuro.